This may take a year or two. Once you have accomplished that, once you have established yourself as an excellent anesthesiologist, the word will spread around. The administration will know you. They will make a note about your contribution. The surgeons be looked upon by everyone, and you internally become extremely confident that you're respected. And I think the first point I would like to mention is, unlike what we think, in US, the anesthesiologists are not getting as well paid like their other colleagues. The surgeon, most of them would like to have the most skillful anesthetist, because one cardiac arrest, one hypotensive case, the way you communicated, the way you spoke to the patient, the way you followed up the case, when they see that there is a difference in the way you handle the case, you naturally become the winner. So every place where I went looked saturated. But it was, even then, not now, even then, even my wife was asking, have you made a mistake of coming back here? But it lasted only. There is a subtle difference between men and women. I want to quote it. I don't want to be misconstrued. So we have about 540 applicants for who will be taking the exam. And in fact, last year it was more. It was 8. Primarily, everybody thinks it's political. When you say, many people ask me the question, you have been so academic and now why you want to become political? So if I need to accomplish all this, we need to be in a responsible position where you can collaborate with
Hello all, this is Dr. Dheeraj Masapu. I'm a consultant anesthesiologist and welcome to my channel. So today we have Dr. J. Balavenkat with us. Sir is a senior consultant anesthesiologist and academic director in Department of Anesthesia and Perioperative Care in Ganga Hospital, Coimbatore, India. And not only that, Sir is a visionary leader and also he conducts a conference called as GARC. If anybody gets invitation for that conference, that means they are a very qualified speaker. So I got the opportunity 2 years back. Luckily, Sir has called me. After that, we developed friendship and bonding with Sir. So welcome to my channel, Sir.
Thank you so much, Dr. Dheeraj, for giving me an opportunity to be a part of your channel. And I highly impressed with what you have been doing, both professionally and also to help young people to scale great heights. Thank you.
Thank you, sir. Thank you very much, sir. It is our pleasure that you are coming to our channel, sir. And sir, today, some of my subscribers have asked a question which I want to put forward to you. The question is, as a specialty, anesthesia is not being recognized, is what my subscribers felt. Most of them are young anesthesiologists. So their question is that how to develop the recognition for the branch. So I would like to just tell my subscribers what happens if the specialty is not recognized in a longer run. So what happens is the management of the hospital will not understand the importance of the specialty. The equipment which you really want might not get approvals. And also the manpower that you really require might not get approval. And the programs which you really want to conduct might not get an approval. And raising the funds might be difficult. And like that, so many disadvantages will come over a longer run if the specialty is not recognized. And it's quite opposite to the surgical specialties where they were recognized and everything, whatever they want actually happens. And so this is the serious. This is a very serious problem if you don't address. If every anesthesiologist, if they really want to just come, take my salary and go, then this problem will become bigger and bigger over a period of time. So I think this is the time to address this. And why I chose Sir is an example, and he has actually developed the anesthesia department in Ganga Hospital, because when I went, I saw how much they value the department, how much they recognize the department. So how to make every hospital like Ganga Hospital and how to transform that is the question, sir. It's a single agenda this video is about.
Yeah, thank you. Thank you, Dr. Dheeraj. And I felt extremely delighted and happy to invite you to the Ganga Anesthesia Refresher course as a faculty, because you brought in a lot of value with you. You brought in a lot of new things, subcortical monitoring and how you do complicated neurosurgical procedure, and establish yourself as an iconic name in your institution. So you earn respect. So I think to begin my talk, I thought I should compliment you for the journey that you have undertaken on accomplishing professional excellence. So to answer to your question, very, very pertinent, very important. I think every young anesthesiologist should introspect on his journey that he's going to take. So what I'm trying to do now is to kind of collate my thoughts, and I'm going to present how it was when I started, how we evolved, and how we achieved what we are today. I joined the Ganga institution way back in 1995. So this is my 28th year. And I wanted to say that nothing happened overnight. It's a journey. So first thing is, I wanted you to have patience. In when you embark on a journey, I want you to be very patient. Now, when you join an institution as a youngster, what is the first and most important thing that you need to consider before making yourself a full-timer in that institution? Because only once you join and work for a few days, you will understand the environment in which you're working. And first, the environment has to be conducive. So what do you mean by a conducive environment? Number one, very ethical practice. Number two, your seniors are ones who are trying to help you to become the best. And number three, you're working with surgeons who are very progressive, both ethical and very progressive. And they don't work on mediocrity. They work on cases which are challenging. Because I personally feel when the surgeon takes more challenges and poses that challenge to the anesthesiologist becomes better and better. So I think these are the things that you need to consider when you begin your career and when you decide that you are going to be a full-timer there. And the last thing I would say is the money involved. In the first 2 to 3 years of your career, you work on the three things which I said, rather than thinking about how much money you're getting. And do not get confused when another institution calls you and says, I will give you another 25,000 more. I don't think you should embark on the journey of switching sides so fast. So once you're sure that you've got a very conducive environment to grow, then do not even think based on the multiple offers you get. Now, once you have decided that you're going to be a part of this institution, now first and foremost, I'm going to deal with this. First, you will actually do an introspection and analyze based on the surgical cases you do and the surgeon you operate, what are the challenges that you have? Whether you're competent enough to handle all the challenges in terms of your skill, in terms of your knowledge, in terms of your wisdom. And if you think there is something lacking, I would want you to spend some time to impart that particular knowledge into you. For example, you never knew how to do a target-controlled infusion and total intravenous anesthesia. That's a new skill. You were not aware of it when you were a postgraduate because it wasn't used. But your surgeon requires it. So now you will embark on a journey of learning that and making it yours. So first is analysis of the gap that you have in your professional competence and try to fill up all the gaps. And skill comes over a period of time. Initially, an intra-arterial line, if you want to start, may take some time. But in the process of learning it, in another 6 months to 1 year, you will become excellent. You will do within seconds. Starting a venous access, doing a point of care ultrasound, I think this has become inherent component. So the first and foremost thing I wanted to say is match the requirement of your institution on your skill sets, knowledge and wisdom, and first conquer all that. Once you conquer that, what happens is you are respected by your surgeon, your junior colleagues, senior colleagues, even the paramedical staff. The minute you enter the theater, you bring in so much of confidence and positivity that the minute they know you have come in, even if it's a challenging case, they're rest assured that you will contribute the best. So the first is to earn the respect of everyone around you inside the operating room. This is step number one. This may take a year or two. Once you have accomplished that, once you have established yourself as an excellent anesthesiologist, the word will spread around. The administration will know you. They will make a note about your contribution. The surgeons go and keep talking about you to everybody around. So you're branded. So I want you to accomplish this branding first. Because once you have established this branding, Then you will now embark into the next phase of your establishing yourself and becoming more visible. So now what you do, you will speak to the surgical team and the administration, and you will say, I am very interested to take on few more responsibility in this institution for better patient outcome. And I will tell few examples which I went through. So first, I said I found out the hospital-acquired infection as one of the common things which prevented from patients going home earlier. So I took over the HICC chairman position. In the process, I learned a lot about hospital-controlled infection. So you formed a cell. You involved surgical team, you involved the nursing team, you involved various people involved in the HICC, the housekeeping. So it's a broad-based group, and every month we met. And the microbiologist. So every month we met and we worked on what are the common organisms and what is the kind of antibiotic stewardship that we are following, what are the practices that we do, like hand hygiene before and after. We started doing audits. Then we created what is called as a link nurse. So in every floor, we created link nurses. So the link nurses were educated very well. And this link nurses will go and educate all the other nurses. And for example, we found out urosepsis was very common in geriatric women. And then we started putting what is called as a catheter nurse. Everybody cannot do the catheterization. So the most trained one will do the catheter. These are things which I'm giving examples of how we enriched the HICC and brought down the hospital-acquired infection. So this spreads. This spreads that Dr. Bala is doing a lot of work on HICC and our infection rates have come down. This catches the attention of the administrator. The next thing I embarked on is I found out that there are a lot of medication error. There are problems in prescriptions. So I met with a clinical pharmacologist. So we formed a pharmacological committee and we did a lot of audits to see the prescription. And every month we also reviewed this, then again called for a meeting and we found out the gaps. So what happened in a few days to few weeks to few months, we developed a robust system on preventing medication errors. So again, now the administration hears this. This is what has happened. Next, you move on the journey to the blood bank. So you call for a meeting of the blood bank medical officer, understand in this 1 month, how much was used, how much was reserved, how much blood went as a waste, and what were the products that were used most, and the efficacy of the functioning of blood bank. And we have so much there to contribute. And this resulted in the surgical team ordering the blood. Specifications were given on when to order, how much to order. So the blood was not wasted. So again, this reaches everybody in the hospital. So what I'm trying to tell is in anesthesiologist visibility becomes pronounced if he embarks on a journey to take few other responsibilities which will result in better patient outcome. So I wanted all the young anesthesiologists should think on several avenues where they can contribute, where they can take the leadership, and where they can prove that the outcomes are better. The minute you do this, the surgical team finds you such a treasure. They start loving you. They're saying that, oh, you are so good. You're contributing so much. So, but in this process, I didn't think about the money involved. I didn't think about the time involved. I just thought that I should contribute. Because I think every patient comes into the hospital, wants to go home with the least morbidity and mortality. And as an anesthesiologist, we are fortunate enough that you know most of the things that you are dealing with, like blood transfusion. The next big step that we took forward is in 2022. That is, after 7 years of me joining the institution, first we encroached into the blood bank, into the pharmacy, into the infection control practices. They were small, intrusions. having gained some confidence and having made people respect you for what you have contributed, now we requested the surgical team to say whether anesthesiologist can take the responsibility of perioperative physicians. So we said over a period of time, can we wean off all the physicians inside the hospital? We will have a panel of experts like a gastroenterologist, a cardiologist, an endocrinologist. They will be in the panel, but we will call them whenever needed. We also know that we cannot be the solution for every challenge, but also we know that 90% of the common problems can be addressed by us. And so we took up this journey. And this last 21 years, I'm extremely happy to tell that this system works very well. The anesthesiologists are doing ward rounds. They were there in the white coat. They do the ward rounds. And in the HDU, in the intensive care, in the post-operative ward, everywhere there is anesthetist. So the hospital evolved in such a way, there are only two specialties: surgical specialty and anesthesia specialty. But this may be a challenge for those who are joining a multi-specialty hospital. You may ask me a question. You're a standalone unit or focused orthopedic surgical unit, so it's good for you. But what if there is already an existing cardiologist, a pulmonologist? Let them be there. But I want each one of you to grow exponentially in cardiology, in pulmonology. So you do the basic finding. Like you do a lung ultrasound and find out whether it's a consolidation, whether it's a pulmonary edema. So then you call them. You say, so now I have a patient and the saturation was low. I've done a lung ultrasound. It shows there is a pulmonary edema, and also the left ventricular function is slightly deranged, and record everything and ask them to give an opinion. So now what happens? You have gained so much insights into something which they only were offering, but now they now respect you so much. They said, oh, every finding is there. They'll start telling you, so why do you need me? So you should come to a stage where you need to tell them. Otherwise, what happens? They think that anesthesiologists are dumb. They think that for everything we write, and they think they become, like when they come itself, the way they treat you, they look at you, they think, oh, you don't know anything. But when you convert that into presenting it in such a way, and even when you talk to them, you say, this is my finding, this is what I think, this is what I think possibly is the management, but you're an expert. I just wanted your help in making sure what I got is right. So now what happened? The visibility in the other specialties and what they go and tell, it's like a wildfire. If one good thing you do, it goes into the hospital circuit, and slowly, you are building your reputation. So what I personally feel is we should not shy away from taking responsibilities. The more responsibility you take and prove to them that you can make a difference in the outcome, people start respecting you. When you accomplish that stage, then you will say that I need one more ultrasound. I need a TCI pump. I need one more monitor to monitor bispectral index, because I think this will add a lot of value to the outcome. So when after establishing yourself with the minimal gadgets you had, now you slowly start requesting for additional help. And they always now think that if you ask, then there is some definite reason in doing it. And immediately they'll say, okay, please get a quotation from 2-3 companies. Tell me which one is good. And they will even allow you to choose the one which you want to do. So in a nutshell, you need to brand yourself. You need to prove yourself. You need to be respected. And you need to be, along with it, you should have tremendous integrity to the institution where you work. Never, ever tell anything bad about our institution to anyone outside. This gossiping is one which prevents us from growing up in the ladder. There may be deficiencies, but those deficiencies only for you. You can talk to about it to the institution, but not even your friend. When they make a phone call, you tell, oh, see, this is a big problem in my institution. They don't do. Please don't do that, because within 2 minutes, it will reach your hierarchy. And so in the process of building a legacy for yourself, whether it is small, medium, or big, you need to have certain strong points, personal traits. So integrity is very important. Honesty is very important. Positivity is very important. I think when there is a conglomeration of all these factors inside you, you really be looked upon by everyone, and you internally become extremely confident that you're respected. And I think it's not far from now that every institution in this country and in this world will have anesthesiologists who will take additional responsibilities, because I see a transformation. I see a transformation in where the ultrasound is used. Initially, it was for nerve block, for venous access. Now it has gone into point of care ultrasound. People see the IVC and then give IV fluid, or they see the lung and the IVC, decide to give whether a diuretic or whether you want to use a inotrope. So I think even in India, we are maturing very well. And if this trend continues, maybe 5 years down the line, 10 years down the line, anesthesiologist will become an inherent component of every system, and they will be highly respected for what they do. This is in a nutshell, which I just wanted to tell the young minds on how the journey that need to embark on to accomplish what they want to accomplish. The future is very bright. It's all up to us to march the right path, to collate with people with positivity. And when you do this, you move from one pedestal to the other pedestal, and you will soon grow up in the ladder. And looking back after a few decades, you will feel so happy that you created a system, you created a process, you created strategies, you created clinical pathways. And even if you have so many juniors, they will follow all the protocol that you set in. So, and the outcomes are going to be good. And also, I wanted you to teach as many youngsters as possible. Pass on all the skills you have to the others. This is the other way people respect you. Make everybody around you competent. And don't worry that if they become competent, will they become a challenge? Never. Never they will become a challenge. So I wanted you to become a mentor for several young minds, and this has got a snowballing effect. Like Dheeraj with his YouTube channel, I think he's reaching out to several young minds. He's trying to pass on the pathways that you have to take. Dheeraj, I think what you have done is phenomenal, because
Thank you, sir.
it is important that when they pass out their MD, they need to know what pathway they have to take. And what you're doing now in enhancing and enriching them with the essential ingredients for their growth will go a long way in making India and Indian anesthesiologists a superpower and a power to reckon. And I hope I gave certain insights into what you asked for, and I'm ready to answer any other question that you have in your mind.
Just to summarize, first we need to develop the skills, and then we have to embark upon different other areas in the hospital and prove that we can develop the organization. And after that, we have to develop the perioperative medicine. Something like that is the way. And I also see a lot of international students coming to your hospital and the conferences that you do. So all that also will add up to the recognition of the center right now, sir.
You're right, because what we started doing the international fellowships from 2014, and what actually drives us doing this is we get colleagues from across Africa and Southeast Asia, and when you talk to them, you understand how much we can contribute to them. With full credit to those institutions, they have some gaps, and India is slowly becoming a knowledge hub because of the clinical work that we do. And what I realized is when you do an analysis of the fellow prior to the fellowship and after the fellowship, you made them so competent. And then when they go, the only request I give them is, when you go back to your respective countries, please take leadership roles. Please guide and mentor young minds. What you were capable of doing by coming here, not all of your junior colleagues will be able to do. So you become the power center of teaching in your country. So in this process, what we have done is we have prevented morbidity and mortality in a different country because what we were able to emphasize upon. So this is the biggest happiness that I get sitting in a small center, getting people from across the globe, to do things, learn things, and they go back and do it. For example, in Rwanda, after the genocide, all the anesthesiologists, most of them were killed. So the young anesthesiologist did not have adequate skill and knowledge. So we had Dr. Nayanvi. I can quote him because he has given me a free hand to quote his name. He's from Kigali. So he learned all the techniques, and he has gone back and he has started his own training center. And now all the Rwanda anesthesiologists get trained in all these aspects which we discussed. So you feel very happy. So it's just not only making yourself and your hospital good, it's making country good. So when he goes to Kigali, he doesn't say that I went to Ganga hospital, I met Dr. Bala. He only says, I went to India, I learned a lot of things, I came back. So the the country itself gets respected. So it's got much more implications than teaching a person. So we are putting this country up in the ladder by contributing to other colleagues in other countries. And I'm sure, Dheeraj, I think soon we will start international fellowship in your center. And because neuroanesthesia, a lot of people do not know in these countries. And I think you can make a huge impact.
Yes, sir. I have one more question, sir. In the vision statement, you mentioned that Indian skill squad is one of your visions in the 10 visions that you have given. So in the skill squad, actually, most of my subscribers, they ask me actually, sir, are you conducting any workshops? Please let us know. If you're conducting any skill development program, please let us know. I think if you can involve our channel subscribers in the skill squad that you're doing, it will help the subscribers, sir.
Yeah. So actually, there are two reasons on mentioning this skill squad. Number one is to enhance the skill sets in India. So, for example, GARC is one which is something which we aim on a holistic growth. That's why we have workshop, master classes. The upcoming GARC is in January 18th to 21st. And all the viewers who are interested to come, please can log into www.garcindia.com and would see the workshops, master classes, register for themselves. And sometimes it's just that small extra skill set that you will develop will make a huge difference in your clinical practice. That is one aspect. The other aspect which I was looking at is, suppose we train, for example, your listeners, some 40 people become very proficient. What is my vision is to develop an Indian skill squad, and they will visit countries which need our help. For example, there are so much of requests from Zambia, Zimbabwe, Mongolia. So we will send a set of 5 anesthesiologists to go and stay there for 2-3 days and educate them in what they want. And this is exactly what I meant by developing skill squads, Indian skill squads, and they will go to countries where they need our help. And in this process, you are trying to create an impact in several countries across the globe, so that they look forward for India also, and not all the time they look to the West for getting solutions. So India will become a solution provider for their challenges. This is what it was in my mind for the skill squad, because 2 years back, there was a request from Egypt to come and teach them the trauma life support. So 8 of us went from here. We stayed there for 3 days and educated close to 80 doctors on trauma care. And after that, their outcomes have become better. So this is exactly what I meant in developing skill squads of India, who will embark on journey to go and teach people outside. And I wanted the youngsters to be a part of all these process, because the anesthesia is not just giving spinal, intubating, extubating. There is so much more which will give us happiness, and you will love it. Once you go to Africa, you teach people, and the African doctor writes back a mail to you saying that, so thank you so much, Dr. Dheeraj, for whatever you have done to us. We never knew anything, and now we know everything. And this has got such an impact. And I wanted a lot of your young viewers to aim to become a teacher, first to learn themselves and then become a teacher. We will give them opportunities. Now the requirements are so huge. We'll give them opportunities, and if they're interested, we will form several skill squads like this and send them across the world.
Oh, superb, sir. This is a very good thing. I think me and my channel will get involved in the skill squad development. So, sir, last question I would like to ask: how do you see the future of Indian anesthesia in the upcoming 20 to 30 years? Like, how do you think it will grow? For example, in USA, anesthesia is one of the top specialties. Like, they get paid on par with the surgeons, on par with radiologists, and in even in Australia, it is on par with other specialties. Even in UK, it is on par with other specialties. But in India, it is slightly we are with respect to the payment and other things. So in the upcoming 15 or 20 years, how do you see it in India?
The first point I would like to mention is, unlike what we think, in US, the anesthesiologists are not getting as well paid like their other colleagues. The reason is there is a group of specialists which they call it as CRNAs. They are certified resident nurse anesthetist. They undergo a program for 9 years to become nurse anesthetist. And what happened initially, the anesthesiologists themselves wanted a lot of CRNA so that their work becomes less. So what they will do during intubation, extubation, they will be there and CRNAs will do all the work. This I have personally seen in several of my visits to institutions in US. Now they became a challenge. Now the CRNAs have asked, why can't we do anesthesia ourselves? Why should there be an anesthesiologist? And the difference in the pay between CRNA and the anesthetist was also not very huge. So in fact, even in the US, the anesthesiologists are being challenged in a different format. So I think we do not know their internal problems. That's why we think they are in a very high pedestal, which is untrue. So that's point number one. Point number two is when you decide to go into a government sector, you know what is the pay package. So there, I think the new pay commission, the number of hours they spend there, the pay has definitely increased than what it used to be earlier. But what happens is corporate units, again, it depends on your skill sets. If you prove to them you're good, it's a question of first 2 to 3 years. And when they think that you have become an inherent component, you're very crucial, very important, they don't want to lose you. So they will keep increasing your pay package. So for that, you have, again, I wanted to tell that you need to prove yourself first, and then the payment will go high. And now the challenges happen in private practice. So here is the biggest concern. So when you are challenged in the private practice, the most important thing is, if there is one surgical case, there are 6 people or 10 people available to do the case, and someone is able to do it a particular rate and the other one is wanting a higher rate. So here is the catch. And what again I personally feel is, the surgeon, most of them would like to have the most skillful anesthetist, because one cardiac arrest, one hypotensive, one bad outcome will shatter their practice. So though for simple cases, they will keep calling all of them and give a small pay. But if the case is slightly complicated, they will wait to get the best anesthetist. So now I want you to graduate to that level of handling the critically ill patient. So number one, the pay also becomes more. And number two, after some time, all the VVIPs, all the doctors' relatives, they will call you. So essentially, everything I feel is related to your contribution to yourself in becoming one of the best. Then money is definitely not a problem. I can vouch on this. Initial 2 to 3 years, when things are not settled, you may not know what's happening. But then if you take the pathway which we just discussed, I think 5 years down the line, you will become an inherent part, and they will never like to lose your services. So this is how I look at the whole problem.
So thank you very much, sir. And one more statistic I would like to tell you is, per year 4,000 anesthesiologists are being graduated. There is a number of anesthesiologists coming out. So in a period of 10 years, there will be another 40,000 extra anesthetists added to the present anesthesia number. So can there be a saturation? Is another question.
Actually, if you show the figures, if you talk about the figures, it is looking very tough. But I will want to give you an anecdote. When I finished my MD in PGI Chandigarh, this was in 1995. When I came to Coimbatore, initially Ganga Hospital was not open. So I printed a visiting card and I visited all the nursing homes and the surgeons because I did my undergraduation. I said, sir, please call me when you have a case, when you have a case. And everybody told me, this is first on call, this is my second on call, this is third on call, fourth on call. Okay, you may be the fifth on call. So every place where I went looked saturated. But it was even then, not now, even then, even my wife was asking, have you made a mistake of coming back here? But it lasted only 3 months. Because even one case they call you, and when you put your stamp there by the way you did the case, the way you communicated, the way you spoke to the patient, the way you followed up the case, when they see that there is a difference in the way you handle the case, you naturally become the winner. So I think more the challenge, the more the better outcome. Everybody wants to be good. So I think it's good to have a challenge. The person who wants to get the Olympic medal works for 4 years. And in a 100-meter dash, it is few seconds which decides who is the winner. But then why he became the winner? Just because he invested so much time in himself to be good. So again and again, I want to reiterate, please invest as much as you can on yourself. And every single challenge that you think is on the way will get negated. And also, it's a fact that even today, in many of the centers, they are saying that their anesthetists are so busy, they're not available. Even in big cities, the corporate units are different. In private practice, the anesthetist, or if you're good, you're called to so many places. So even before one case gets over, then you're called to another case. So which means even today it is happening, which means even today the number of anesthetists, good anesthesiologists required are still high. So never ever will there be a time when any of us will starve. I can guarantee for that. And everybody will earn very good. And our small aims in life of having a car, of having a home, good education for our children will be met at any time, irrespective of the number of anesthetists coming in. But you need to be prepared for the race. Take up the challenge and start educating yourself when you're a postgraduate itself. Don't study to pass an exam. That is only one aspect of your life. You need to pass the real exam of the life. And for that, you need to have a structured reading even when you're a postgraduate. Every day, 2 to 3 hours you should spend on it. You need to see the patient preoperatively. Even your system doesn't want you, you have to do it. And go and see the patient postoperatively. Analyze what has happened. I think these are the things that you will have to invest on yourself to become the best. And if you do that, believe me, you will be recognized forever and you will never start.
My subscribers will be very happy after listening to this. Okay. And sir, one more question, sir, about the work-life balance of anesthesiologist. What is your broad opinion about the work-life balance aspect?
So I actually divide the anesthesiologist life into 5-year plan. So first 5 year, now I'm graduating my MD. So the first 5-year plan. And here I would want to be very frank and open because we do a lot of fellowships. I meet with a lot of young anesthesiologists. There is a subtle difference between men and women. I want to quote it. I don't want to be misconstrued. I don't want to be thought that I'm supporting only males. But women have got more to contribute to the family. So in the process, what I wanted to tell the young minds is, you have to essentially look at your happiness in life. Very important. Professional life is important, but your personal life, according to me, is more important than the professional life. So for me, the personal life comes first, professional comes second. So if in the first 5 years of life, after you finished your MD, for a male, there is not much of issues, like he can keep going and doing fellowships. But I have a small request. I would like to consider all the young postgraduate as my daughter. And if I'm going to advise them, I would advise them not to compete with men in the first 5 years after their MD, because they have certain chalked out responsibility. So I just wanted the young minds to think, if this is my version, don't get me wrong, if you are not married, I think you should get married, because by the time you finish MD, most of them are in 27, 28, 29, 30, that age group. So you can be ambitious to do a postdoctoral fellowship and all that, but I would feel that you also need to give importance to your personal life. So I want you to get married. This is what I tell all our fellows and postgraduates. And if you are married, I want you to spend time with your husband, know each other very well, which means it may be that you take a break from what you aspire to do. For example, a fellowship. Instead, you will go and stay with your husband wherever he works. Take up any job that would keep you occupied, though it is not your vision or aim, but you had the opportunity to live with him, understand him, form the strong foundation of excellent relation between each other. And then I also tell, if you're married, you please, in between the first 2 to 3 years, try to become a parent, because this is what results in excellent family bonding. A child into the family is the biggest factor which keep the family united and a lot of happiness. So after they take a break for 2 to 3 years, now when the child is born, the child was given enough time. Now you embark on the journey for the women who missed the opportunity to do fellowships, now to go forward. So the first 3 years, everyone in the family, the in-law side and the maternal and paternal side, all of them understand that you were very keen and very important member of the family. You cared for them and you listened to them. Once you establish that identity, and then you give in, and then you put your request that I have a long-standing desire to go and do neuroanesthesia for 1 year with Dr. Dheeraj Masapu. They will allow you to do. So this is the first few years. So first 5 years is to consolidate your family side. That's number one. Number two, however busy you are, however busy professional you are, the minute you enter the door of your house, just throw away the professionalism inside you and you become an ordinary human being. So you will be the father or mother or daughter-in-law or son-in-law or son. Please see the requirements of the family. Try to fulfill them. Don't go there and take another computer and sit there and work for hours together and make them feel so uncomfortable. So quality time with your family is very crucial. And I think you need to take frequent breaks to go out with them, to go for a movie, to things which you may not like at all. You may say that this is something I don't. For example, when I go into the house, I have 2 daughters. They'll be watching a serial, which I think it doesn't interest me. But I go and sit with them, listen to them, I hear them. They should feel that I'm interested in the smaller things that they are interested too. And I spent a quality time with them. So give that feeling. It is not a question of number of hours you work in the hospital. It is the number of hours that you spend in the house appropriately. So you should not go and take a book and sit and read. And you should not say, I have a talk tomorrow. So don't take anything back home. And this will bridge the gap. And I want to spend enough time with your family. So the first 5 years goes in consolidating your family life. And the next 5 years is consolidating your professional life. And the next 5 years, you start taking leadership position in your hospital. And the next 5 years, you take leadership position in your city level, state level, national level. And the last 5 years goes in global networking and establishing your name internationally. So it's a project. Every 5 years, at that point of time, you have something to do it appropriately, and then go slowly. There is no shortcut to success. And success comes when you decide to do the right thing at the right time.
Oh, superb, sir. Excellently told and very useful interview, sir. And sir, if my subscribers, if they apply for a fellowship under you in regional anesthesia, how should they prepare themselves before they present to you for the interview?
Yeah, so that's a good question. Actually, the next fellowship entrance exam is coming on the 20th of August. So we advertise for our fellowships well in advance. Usually the entrance exam is somewhere in the month of August, and we advertise somewhere in the month of February and March in our website, www.gangahospital.com. We have about 540 applicants for who will be taking the exam. And in fact, last year it was more. It was 825 applicants were there. And this time about 540. So we have 6 months and 1 year program. And it starts in the month of January 1st and July 1st. And 1 year program, we are about 12 seats. And 6 months, we are still continuing for the benefit of our women anesthesiologists, because many of them, the family does not allow them to go for 1 year. So we don't want to deprive them of the opportunity to learn. So that's why we still continue 6 months. So one thing which I would wanted to say, those who are, for example, the one who takes the exam in August may be a final year. But when the results are out, when we do the counseling, they can take up the position. They'll finish their exams, for example, in April. They can take the July position 2024. So in one go after MD, they can do their 6 months. And the questions are entirely on regional anesthesia. And it is basics of regional anesthesia. We don't go to asking them hi-fi. So it's a very basics of regional anesthesia. And we go completely by merit. So now the demand has become more, and we were very transparent. So the minute the exam is over, within an hour, once we get it from the people who conduct it, immediately we put it on the website. And the next day we do the counseling. And by the second day, even the selection is over. And we keep a waiting list. And when they come here, they just don't do only anesthesia. So whatever I spoke to you, we try to inculcate them into their mind. We want them to go holistically. And everybody has a white coat. Everybody will be posted in the ward. Everybody will be made to speak to the patient attenders. So we try to make them evolve holistically.
So is there any age limit?
I welcome all of your subscribers to join our institution.
Many people are actually messaging me also, like regional anesthesia, which is the best center. I always recommend your center, and but still it's very competitive. Everybody cannot get the opportunity. So I'll tell them to prepare nicely for the exam, and then they might join your team, sir.
There is also another opening now. The Academy of Regional Anesthesia of India, they've got 15 centers, which we are doing 1 year fellowship. So there are quite a number of teaching centers which are available. It's all there in the website of www.AORAindia.com. So that's another avenue to learn regional anesthesia.
So the last question and the concluding question I would like to ask you, sir. So I learned that you are contesting for the ISA president. In the election is going to be in the November. So my question is, so why did you decide to participate in the election, and what is that is driving you actually to lead this role?
Yeah, thank you, Dr. Dheeraj, for asking me this question. It was not an easy decision because I work in a clinical unit which is extremely busy. And I've also have a lot of academic positions which I need to fulfill. Currently, I'm in the educational committee of the World Federation of Society of Anesthesiologists. I'm also the academic chair for the Asia Pacific Society of Regional Anesthesia and Pain Medicine. And I'm also in the AOLC committee of WFSA. So all this needs a lot of time. But I decided that I will get into this. Primarily, everybody thinks it's political. When you say, many people ask me the question, you have been so academic and now why you want to become political? So actually, I look at it in a very different way. I think time has come to embark on a journey of enhanced patient-centric moves as anesthesiologists across this country. And it's important to do measures on safety. And the other important thing is the kind of infrastructure that is available to anesthesiologists in this country is extremely different. What happens in a teaching institution, corporate versus private practice, urban, rural, there are so many variations. So when we have international guidelines, the guidelines actually work on guidelines which is suiting that country, but it is not for Indian circumstances. So what I thought, we need to create clinical pathways for procedures in different infrastructures in India. So we need to have three types of guideline based on which we will work. You cannot say that don't operate this case in a periphery, because that is not what we should tell them. But we can tell them what are the guidelines that they need to follow. So you should not tell thromboelastography in a rural area. So you need to talk to them on what has to be taken into account when you do that. So one important component is to enhance patient safety by creating clinical pathways which will suit different infrastructure. Number one, that was number two is every anesthesiologist have got a smartphone. So I wanted to develop an ISA app. So the ISA app will have the facilities to do their logbook. Every private practitioner also can maintain a logbook, and we will enter into a kind of an understanding with giants in the field of information technology and database, and ask them to provide us a robust server. So where all this can be logged in and can be stored. For example, even if 50 to 60% of anesthetists embark on the journey of giving their data, which will be kept confidential, but the server will keep recording. So we will know the incidence of postoperative nausea, vomiting in India. On a single day, 10 lakh login will come, and they will say how many nausea, vomiting. And they will also say in those who didn't have nausea, vomiting, what was the drug used. So we will come to know in an Indian population, which is the best anti-emetic that can be used. So this will pave the way for Indian guidelines. So I'm actually more concerned about evolving ourselves rather than depending on what we see in the Western literature. And to make all this happen, you need to have a responsibility and a position. And also, I personally feel that whenever I've gone to meetings outside India, I've always felt there is an Indian speaker who's equally good. But those meetings outside the country have large crowd coming from across the world, whereas Indian meetings do not attract so much crowd. This is because the world doesn't know that India can offer so much. So we should become the learning hub for Africa and Southeast Asia, because we have clinicians who do excellent work, who are very knowledgeable, and who can also speak good English. They are good teachers. So I think we need to utilize these the treasures that we have, and we need to become the educational center. And if we do that, the world will start respecting you. The world will think India is doing so much. And how can I accomplish all this? If I need to accomplish all this, we need to be in a responsible position where you can collaborate with the people who matter and push in a lot of reforms, which will aid and assist us to move forward in the most positive direction. And these are the reasons which made me think that I need to run for this position. And I consider it as a huge responsibility. And I hope if all the viewers think that I'm an appropriate choice, I would be most willing to help by contributing my best to the nation. I've kept national pride more important than an individual excellence. And we always feel very happy when ISRO launches Chandrayaan, or the Virat Kohli hits a winning six. So we get so fascinated by Indian victories. And what is that we need to contribute to Indian anesthesia to become victorious. So I wanted Indian anesthesia to be victorious, and that's why this journey. I hope I will be able to do with all your support in case if I get this responsibility. Thank you, Dheeraj, for asking this question.
So what I feel is like how we are giving different more and more terms to Modi. Not one term. I think we should give you 2-3 extra terms so that you can fulfill the dreams of yours, and along with you, we will also grow. One term is not enough. I think so. 2-3 times you become president.
No, but Dr. Dheeraj, I have a tremendous belief on the youth of India.
Yeah.
If they're shown the path, they will outnumber me and they will do better than me. So I think I have a lot of faith in the younger generation because of their ability to do things better than us.
Okay, sir. So thank you very much, sir. Thank you very much.
Yeah, thank you so much.
Thank you. And
thank you so much, Dr. Dheeraj. I'm very, very happy to have been a part of this interview. And I am sure, and I'm extremely confident, in our lifetime, we will see a different anesthesiologist and Indian anesthesia at an absolutely higher pedestal. And thanks for doing this. And I'm very happy to reach to each one of your users. And I wish them all the best. And I want all of them to think they are one of the best versions in the earth. And they will do wonders. Thank you so much, and God bless them in abundance. Thank you.
Thank you.